Yields. The gentleman from New York is recognized.
I thank my friend from New Jersey for yielding to me, and I rise in strong support of H.R. 5329, the Poison Center Network Enhancement Act. You know, I remember when I was a little boy, my mother used to have a poison control number, which she taped to the medicine chest so that if there was ever a tragedy or a problem, we could call the number quickly. This is obviously along those same lines, and that's why it's so important for the American people to have this. I want to thank Congresswoman Susan Brooks. I co-authored this bill with her, and I want to thank her for her hard work. It reauthorizes for an additional 5 years, as the gentlewoman just said, the nationwide network of poison control centers, which are playing a critical role in the fight to end the opioid crisis. Our country's 55 poison centers are staffed by trained toxicologists, pharmacists, physicians, and nurses who are available 24 hours a day, 7 days a week, 365 days a year to provide real-time life-saving assistance via a national toll-free number, which is 1-800-222-1222. In 2016, someone in this country called a poison center roughly every 12 seconds. So it shows you that it's being utilized and it saves lives. More than 90% of those calls were due to a poison exposure in someone's home, and more than half of all cases involved children under the age of 12. That's why speedy access to poison centers is such an invaluable resource and so important, especially for parents. Poison centers are also saving hundreds of millions in federal dollars by helping to avoid the unnecessary use of medical services and shortening the amount of time a person spends in the hospital if hospitalization due to poisoning becomes necessary. It's clear that these centers are a smart public health investment, but they're also an integral part of our response to the opioid epidemic. Since 2011, poison centers have handled nearly 200 cases per day in this country involving opioid misuse. Data from poison centers has helped detect trends in the epidemic, and experts have helped educate Americans about the crisis and ways they could potentially save the lives of their loved ones. The upstate New York Poison Center, for instance, used the New York State Fair to educate New Yorkers about proper use of naloxone, the overdose reversal drug. This bill would make sure that activities like this can continue. Mr. Speaker, I had the privilege of co-authoring the last poison center reauthorization, signed into law in 2014, and I am pleased to have worked on this important bill. Again, I want to thank Congresswoman Brooks for partnering with me on this legislation, as well as Congresswoman DeGette and Congressman Barton for being original co-sponsors. Let me also thank Chairman Burgess, Ranking Member Green, Chairman Walden, and Ranking Member Pallone for their assistance in bringing this bill to the floor today. As I mentioned earlier, in Westchester County, part of which I represent, 124 people died due to opioids in 2016. And in the Bronx, part of which I also represent, more New Yorkers died of overdoses than in any other borough of the city of New York. We must do more to end this epidemic, and I'm proud to see this legislation moving forward as part of that effort, again in a bipartisan manner. I urge my colleagues to support this bill, and I yield back the balance of my time.
The gentleman from New York yields. The gentleman from